Matthew, another quick TCB spotlight from health. We can see the unicorn. We're in a quiet corridor here. This is Jean-Claude Saghbini. He is the president of Lumeris. So Lumeris has been around a while, helping usually provider customers, plans, and others figure out how to manage Medicare Advantage primarily. Jean-Claude, that's still correct, is it? But give me a quick thumbnail of Lumeris business at the moment.
Yeah, that is still correct. We've been doing this for a good chunk of time. We have the experience doing it. We partner with health systems and provider networks, and we deploy our technology and our operational model to help them succeed in value-based care with a primary focus on Medicare.
Okay, so give me a sense of the scale. How many systems, how many patients on your system, you know, what do they use you for, and then we'll talk a bit about health plans. But yeah. For now, tell me, you know, are you essentially operationalizing their health plans, or are you helping them work with other health plans?
Yeah, we help them work with other health plans. We're in about 12 markets now, managing 1.5 million lives on the platform. And what we do is that we bring a value-based care platform that's primarily designed to succeed in delivering on patient outcomes, as well on reducing costs associated with managing value-based care. We deploy those capabilities into health systems, and in those partnerships, we have technology capabilities as well as operational capabilities that are founded on technology components. They tend to be long-term partnerships, 7 to 10-year partnerships that we engage in, and we are hand in hand in operating partner to succeed in value-based care. So,
if you're working with, you know, if you're working for a provider that's working with a major payer like United or Humana or Blues or whatever, what do you bring to the table that helps them manage that contract better? What are the kind of tools and technology and services that they need?
Yeah, so that's a good question, right? In these engagements, they have risk-based contracts. They need to succeed on them, both in driving patient outcomes as well as managing the cost. We bring effectively all of the capabilities needed, from data ingestion of all sorts of data, claims data, clinical data, third-party data, normalization, aggregation, AI models to extract insights from that data, insights that are relevant to value-based care. And then what we also bring are capabilities to automate as much as possible of primary care services while keeping physicians in the driver's seat, but we automate what's automatable to let the scarce resources that we have in clinicians be able to focus on the exceptions. This is, you know, examples are, you know, automating outreaches to close gaps in care.
Yep.
Detecting various signals that are happening where patients are getting admitted in certain places or discharged from an ER, etc., and driving the next best action. But we also we bring in a transformation of the operating model at the practice level, where now the practices are changing to start leveraging more and more technology as they deliver care.
So, couple of big questions here. I've done a lot of work on looking at the state of what's really happening in the payment model, and even if you look at Humana's reporting, most of their value-based care is not really full risk capitation to the doctor. It's more a mix of fee for service and withholds and bonuses and what have you. When at the sort of coalface, when the doctor is getting paid or the clinician is getting paid within your clients, how are they mostly getting paid?
Yeah, so it's a variety of payment models, but what we always make sure of is that part of the compensation model is compensation that's based on the outcomes that we are trying to drive. You know, examples of that is there are compensations that are based on driving certain metrics to certain targets. So, for example, controlling A1C scores for diabetics, making sure that patients are being seen within 7 days post-discharge. Because that is one of the largest needle movers in reducing admissions. That people are getting the right screening, so colonoscopies are getting done on time, breast cancer screening is getting done on time. Annual visits and high-risk patients being seen more than one time per year. So take all of these elements that we know they're proven, mathematically proven, that if we do them, we boost both needles, the cost needle and the patient care needle, and the compensation models are tied to these different factors.
All right, last question. So, incredible controversy about Medicare Advantage, especially about home visits, upscoring, risk adjustment factors, all of the above. We know there's been a lot of both politics and there'll be some, I think there's a conversation today between Rick Gilfillan and Sachin Jain about this coming on later on. What do you think the changes that CMS has made around the audits, around the home visits, around the risk changes in how they're accepting risk adjustments, what are the global changes you're going to see in Medicare Advantage, and what do you think that means for your business?
Yeah, overall, look, there are various micro changes that are happening, but the one thing that's for sure is that there is a very explicit commitment to value-based care. So every change that's happening, again, you can double click on each one and look at the mechanics and the numbers, etc. But all of the changes are driving in one direction, and that direction is to getting better outcomes at a lower cost. This is big. This is big for the industry because that has been the biggest driver of managing costs in healthcare and start to keeping them in check. At the same time, for us, it's an opportunity to engage more closely with our health system partners because they are being challenged on how to manage in this setting of value-based care. More and more patients are going to get into Medicare over the next 7 years. We're going to hit about 80 million Medicare beneficiaries by 2030. So it presents a very exciting opportunity for us in the U.S. to be able to keep delivering technology solution, operational solutions, and deliver on the outcomes.
All right. You heard it here. It's Jean-Claude Saghbini. He is the president of Lumeris, which has been helping providers deal with Medicare Advantage and managed care and risk-based contracting for quite a while. As to what's happening next, and the future is getting bigger and brighter.
Yeah.
All right, Jean-Claude, thanks for talking to me.
Absolutely. Thank you.